There you go. Uh, Good afternoon, everyone. I'm chairing this meeting for Dr. Jones, who is in transit. And today we have a guest speaker that we're looking forward to having a talk to us. That guest speaker is Jason Glenn, PhD. Jason Glenn is an associate professor in the Department of History and Philosophy of Medicine, the executive director of Repair Project at the University of Kansas Medical Center, and an associate director for education for the newly launched UMKC Center for African American Health. His areas of research specialty include health inequities, mass incarceration, the history of drug policy in the U.S., and the ethics and history of human subject research. He received a BA from Stanford University in 1996, an MA and PhD in the history of science and medicine from Harvard University in 2001 and 2005, respectively. He spent 12 years at the University of Texas Medical Branch as the James Wade Rockwell Distinguished Professor in Medical History within the Institute of the Medical Humanities. Dr. Glenn is also a founder and past director of Sobriety High Incorporated, a nonprofit organization providing community reentry services for persons with a history of substance abuse who were returning to Galveston from prison. As director of Sobriety High, he was also a co-founder of the Galveston County Restorative Justice Community Partnership and the Galveston County Hope Drug Court. His current research investigates abusive policing policies as a structural determinant of ill health in so affected communities. Currently, he is leading a national coalition to pilot and standardize an abolition-based curriculum for delivering healthcare to persons with histories of criminal legal system involvement. And so without further ado, I give you Dr. Glenn.
Thank you so much for that introduction. I'm going to have to start leaving those dates off of those degrees because it's starting to make me feel old now. But thank you all for having me. Let me share my screen and get into this. So as mentioned, my work really focuses on social and structural determinants of health, and wanted to and I'm also the executive director of the Repair Project here at the University of Kansas Medical Center. The Repair Project is really based on one central theme. How do we repair the past harms that have been caused by centuries of unequal treatment that our people have faced, and discriminatory treatment when we go and see the doctor, and also by the misrepresentations in the curriculum. Those misrepresentations that have helped sustain medical racism, that have taught medical providers that we don't feel pain the same way as other people, that have taught medical providers that if we go in and we're complaining of something, we may just likely be drug seeking and may not really be sick at all. All of those issues that come to the fore when we're thinking about this. So it's my pleasure to be with you all and contemplate repair and be thinking about how some of the historical legacies of racism and discrimination are not only the ills that they have caused in the past, but the ills that they continue to cause. And for us to be thinking about reparations in terms of how can we address current structural determinants of health and current forms of structural violence that continue to plague our communities. So I start off with our declaration by our Unified Government Public Health Department when they declared that racism was a public health crisis in early 2023, right? And what did that mean? And how do we begin to wrap our minds around the concept of racism as a public health crisis? Basically, and this is the work that we do at the Repair Project here at KU, is we look at how historical structural racism is a major contributor to poor health outcomes. And when we're talking about historical structural racism, we're talking about a number of things like, for instance, slavery, the idea of race as a biological concept, or thinking that different races constitute different biological categories of human beings. Also, the history of systemic racism and mistreatment in medicine and science, our history of Jim Crow laws, anti-Black terrorism, redlining, and that's one that I'm really going to focus on today: inequality in employment, inequality in education, inequality in medical care, and barriers to basic civic engagement, such as voting, etc., right? And how all of those contribute to current structural racism, whether we're talking about physiological race myths about bone structure and density in African Americans versus other races, or who feels more pain. We have extensive what they call race corrections in in medicine, where we use these algorithms to determine treatment outcomes, and where we ask providers to put in the patient's race. And based on that race, those algorithms give you different suggestions for how to treat that patient. And that is a legacy of colonial racism that we're trying to address. And all of those in that second column there on the left contribute to not only everything that you see there in blue, disparities in social capital and education, transportation, employment, food access, health behaviors, but also an increase in stress and what we call allostatic load or weathering, as well as bias in the clinical setting, right? And all of those impact health. So we wanted to talk specifically about how do we understand that. This is an illustration. Many of you, I'm sure, have heard of the socioecological model. This is more illustration in thinking about upstream versus downstream determinants of health, right? So when we think of downstream determinants of health, what does that mean? The most immediate determinants, things like knowledge, attitude, skills, and behaviors, where our dietary choices, right? Our physical activity choices. A little further upstream, we think about our friends, family, and social networks and the social capital that those networks provide. Then when we get further midstream, we start thinking about organizations, schools, and workplaces and the impact that they have on health. Further midstream, close to upstream, is when we start looking at cities, neighborhoods, resources, and the cultural norms that are associated with the communities in which we live. Then finally, most upstream, we start thinking about federal, state, and local legislation, the policies that impact all of the factors below that, right, in the allegory of the river. So today I wanted to focus on Kansas City specifically and looking at how one policy, upstream policy, continues to be a major structural determinant of health to this day. And I know you all are familiar with the history of redlining. And I'm not going to go over the whole history, but I do want to talk about and specifically frame how this history is so pertinent to Kansas City and its roots here in Kansas City. So this is one of the earliest maps of Kansas City that we have. This is from 1869. And when we think of sort of the initial structural determinants of health here, right, they entailed colonization and resettlement. So the colonization and resettlement of Kansas City areas started with a French trading post on the south side of the Missouri River in 1821. And this is presently northeast Kansas City, where Troost Avenue begins. And I've outlined Troost there in yellow. It was originally a hunting trail and path to the Missouri River used by the Osage. And in resettlement, after the forced removal of the Osage, it was renamed after Dutch doctor and slave owner Benoist Troost. And I know some of you are familiar with this, so those of you who have some familiarity with this, I hope you will indulge me briefly. When we look at Black settlement in Kansas City prior to systemic segregation, you'll see that the railroads and stockyards were where most Black families were ending up, right? And those were because in the Great Migration that started around World War I of Black families moving out of the South to points northward and points westward, right? The railroads and stockyards had people from all over the US flocking to Kansas City for work. And at the same time, the thousands of African Americans that were fleeing the South landed there as well. And they were choosing to settle in Wyandotte County, largely in the Condaro neighborhood, right? And in Kansas City, the Black population by 1885 had already quadrupled. But the location of Black families remained primarily a matter of both affordability and school availability. And school is going to be one of the main topics that I talk about here in this history of redlining in terms of how it continues to impact the quality of schools and how the quality of education continues to be a major structural driver of health inequities. And it is one of the lasting issues of unfinished business of the civil rights movement, where we still have this legacy of racism that is still in play today and continues to have a detrimental impact on African American families. So our story, of course, would be incomplete without J.C. Nichols and his vision for creating white suburbia. And this is key to, right, Kansas City's own legacy in what became a national phenomenon. Of course, J.C. Nichols was born the form of fathers in Olathe in 1880. He graduated KU in 1902 as a pre-law student. Then he went to Harvard for a second bachelor's degree, where he was turned on to the ideas of economic history. Dr. Glenn, what in the world is economic history? Glad you asked. So economic history at that time was a new discipline that was born in the late 1800s, but it reimagined history through the lens of economic development, particularly a colonial perspective that perceived land in an indigenous or agrarian state as largely undeveloped, and that land only acquired value through transforming it into urban areas. Nichols thus turned on to these ideas of economic history, returned to Kansas City and set up a real estate development company with two friends who were lawyers. And he conceived of real estate development in these economic terms, i.e. how to make real estate investments build wealth for families and establish an efficiently functioning middle-class America. And that's still the ideal that we live with today, that we build wealth for our families through real estate. And on the face of it, that sounds like a perfectly sensible idea, right? But it was the implementation and the vision that he had for it that was tinged and hopelessly, inextricably intertwined with racist ideas that made it so pernicious. When we look at his innovations in urban planning, right, the idea that a land or subdivision could be classified as residential while still being platted was a novel concept at this time, right? So in other words, if you bought a piece of property, the person who bought the piece of property right next to you could do virtually anything they wanted to it. That means they could put a slaughterhouse there, they could put a smelter there, whatever. And so that meant that this idea of subdividing land exclusively for residential purposes, it presupposed a level of planning and control that was not the norm for American urbanization at the time. This is a little later map of Kansas City. This is from 1885. We're going to talk about creating Millionaires Row. So back on that early map that I showed you, up on a bordering truce was a plot of land, this larger plot of land up here. We're going to talk about that plot of land. This is the Porter Plantation. And Reverend James Porter was KC's first Methodist preacher. And as a preacher, he owned a 365-acre plantation bordering truce between 23rd and 31st Streets that held between 40 and 100 slaves that was established in 1834. And then after the Civil War, Porter's family began selling off portions of the plantation as lots, which led to the creation of Millionaires Row and the precursor to the country club. And this is where J.C. Nichols started buying land for development. And it's where he got his inspiration for his larger suburbia plans. So what were those plans? As he wrote, our plan is to develop whole residential neighborhoods that would attract an element of people who desired a better way of life, a nicer place to live, and would be willing to work in order to keep it better. Again, sounds so benign, right? This is one of the original advertisements for houses being constructed in the country club district. Some of these houses are still standing right now. But in his ideas about planning for permanence, right, he selected each architectural and landscaping element of his subdivisions to reflect a picturesque suburban ideals, then only sold properties to the type of resident that he believed suited his racial vision. And he maintained this through deed restrictions that forbade selling or ownership by African Americans, Jews, and any other non-white groups. And these legal contracts or restrictive covenants were touted as measures to preserve property values, solidify community cohesion, and provide the high-quality, exclusive residential environment promised to buyers. And Nichols viewed socioeconomic and racial homogeneity in his properties as among his highest priorities for their success. And so the restrictive covenants he had his legal partners write in to renew automatically from homeowner to homeowner and required an elaborate process to repeal. And so he also popularized mandatory homeowners associations, which are the bane of my existence, to uphold his vision of a white suburbia that required community members to enforce such codes. And these deed restrictions and homeowners associations became popular tools in city planning, not only throughout Kansas City, but then the nation. And by the 1940s, mandatory homeowners associations were common throughout the United States. So yes, we have him to thank for that. But it wasn't just here in Kansas City. After these innovations were made in Kansas City, he set about to create some national influence. He joined the General Committee of the National Conference on City Planning, and then was leader of the National Conference of Subdividers. He was also founder of the Urban Land Institute. He was director of the National Association of Real Estate Boards. He also sought and lobbied for strong government regulation, private trade association agreements, and zoning laws. And he saw his greatest success in lobbying the federal government to create the Federal Housing Administration in 1934. And the FHA's 1940 publication, Successful Subdivision, cited J.C. Nichols' developments as among the best in the entire country and those that should be emulated. So with the New Deal and FDR, and as part of that New Deal, we got the Homeowners Loan Corporation to complement the FHA. And this was a government-sponsored corporation established in 1933 by the Homeowners Loan Corporation Act to help prevent foreclosure and expand home buying opportunities for American families. To purchase a home prior to the HOLC, buyers had to pay as much as 50% of the total home cost up front and pay the remainder usually in about 5 years. We couldn't imagine doing that now, but back then you could buy a home for only a few $1,000s. And so putting up 50% of the price, well, it wasn't easily accessible to poor families, but it was more easily accessible to working class families. Under the new scheme, FHA issued bonds and then used the money from those bonds to purchase mortgages from lenders and then refinance the loans from the borrowers. Polk allowed white borrowers to purchase homes for as little as a 10% down payment. And they also, most importantly, generated maps during the 1930s to assess creditworthiness. And here is our original red line map of Kansas City from 1939. I threw in the little medical icon there to show where I'm sitting here. But this is in the heart of Wyandotte County, where KU is located. This is also original red line map of Kansas, of Wichita, Kansas, from 1939. And here we have like some of the actual, as you saw, like most of Wichita was red. Only a very like small amount was in green or blue. And here's the actual form that the Hulk assessor filled out, right, when writing about Wichita. And you'll see there under number 4, detrimental influences, the heavy Negro concentration in Wichita. An old, poorly kept, and terribly run down drainage canal with attendant stench, railroad tracks, packing house on the north end. But the presence of Black folks in a community nearly guaranteed that community would be outlined in red. And we know the impact of what this caused, right? In terms of over generations, how the value of land in green line areas did compared to the value of land in red line areas. And the accompanying historical divestment from these communities, right? So these home refinancing patterns that were established in the 1930s by Holt reinforced subsequent divestment or disinvestment in red line neighborhoods and municipal zoning. The Hulk assessors ranked neighborhoods on a scale of increasing mortgage default risk from A, desirable, that was in green, to D, hazardous, that was in red. And nearly all of Kansas City, Kansas, as it existed at the time, was rated C, declining, or D, detrimental influence of undesirable populations. This is true for the Kansas City, Missouri side, too. And then Hulk urged banks and lenders to refuse to make loans in D-rated areas, making home loans difficult or impossible to obtain. And these red line neighborhoods also discouraged business investments like supermarkets and desirable housing and shopping districts. The Hulk assessors, like we said, use explicit racial criteria to assign neighborhood ratings. And so in various cities across the US, the presence of Black folks in a neighborhood all but guaranteed their D rating. Was this challenged in the courts? Yes. But the courts didn't do a really good job of taking up the issue. The popular use of racial restrictive covenants that emerged after 1917, when the US Supreme Court ruled in Buchanan v. Worley that city-initiated segregation ordinances violated the 14th Amendment and were thus illegal. However, privately initiated segregation was not. And so innovators like Nichols, who had initially studied law in college, right, then turned to restrictive covenants as a workaround of the Supreme Court ruling, right, playing on the court's longstanding reluctance to restrict private acts of discrimination. In 1926, the Supreme Court upheld the validity of restricted covenants in Corrigan v. Buckley, arguing that while states are barred from creating race-based legislation, private deeds and developer plat maps are not similarly affected by the 14th Amendment because they were private. And racial restrictive covenants consequently became key instruments to promote and establish racial residential segregation across the United States. The court did revisit the matter in 1948 in Shelley v. Kramer and ruled that racial restrictive covenants are legally unenforceable as they were in violation of the Equal Protection Clause of the 14th Amendment. But the court made no provisions to enforce it, and so they continued. Communities and realtors continued to uphold racial restrictive covenants until passage of the Fair Housing Act in 1968, because it was perceived in their best financial interest to do so. for fear of declining property values. But by that time, however, the deed restrictions had become both the physical and political model for zoning laws and subdivision regulations that determine how close highways were going to be put to certain neighborhoods, or whether or not how close factories and other polluting industries might be located near a given neighborhood. In all, between 1934 and 1962, the US federal government underwrote $120 billion in new housing loans, and it created $1.5 trillion in generational home investment wealth. And less than 2% of those loans went to persons who were not white. When it came to keeping the racial covenant, the National Housing Act encouraged land developers, realtors, and community residents to write racial restrictive covenants to keep people of color out of new neighborhoods and keep them segregated, all to keep them from being redlined. And this federal policy created American suburbia as white utopias. Then subsequent decades of disinvestment in C and D rated neighborhoods resulted in large swaths of poor housing stock where communities of color remain concentrated to this day. 74% of neighborhoods that Holt graded as high risk or hazardous are low to moderate income neighborhoods today, while 64% of the neighborhoods graded hazardous are minority neighborhoods today. Here's the actual copy of a racial restrictive covenant in a deed. You'll see there number 14. No property in said addition shall at any time be sold, conveyed, rented, or leased in whole or in part to any person or persons not of the white or Caucasian race. And if you keep reading there, you see that they make an exception for domestic servants. Like if the domestic, you're going to have your domestic servant can live in, but in no way, shape, or form can a black person ever be living here if they're not in service to a white person. Again, let's return to this red line map of Kansas City. And I'm doing this because I want to also take a look at this initial map of the Country Club District as drawn up by J.C. Nichols Development Company. The roads there, all the little green dots, those are trees. And some of you may have seen this before, but it was, seen as vitally important to the health and well-being and serenity of a community to have the avenues and major boulevards completely lined with full mature trees. And we still see that disparity in tree canopy today. But so that's why those roads look a little funny, because it's hard to tell here that those are trees. But what I'm going to do is I'm going to superimpose that map of the Country Club District over this green line, over this red line map. And we can see how the green areas and the blue areas, right, completely overlap with J.C. Nichols development areas. And almost all the other areas throughout the greater Kansas City metro area were graded either hazardous or dangerous in yellow and red. And when we look at the impact on contemporary land value, we see that there's nearly a tenfold difference between the value of land in historically red line neighborhoods versus the value of land in historically green line neighborhoods here in the larger Kansas City metro area. And this depressed housing contributes to depressed health in a number of ways. The depressed nature of housing stock in KC and Wyandotte County creates conditions leading directly to poor health. For example, nearly half of the county's residential parcels, through a combination of age and low assessed value, have a lead poisoning risk due to lead-based paint. Poorly maintained housing also harbors asthma triggers like mold and infestations of insects and mice and rats. And depressed housing near the Kansas City or near the Kansas and Missouri rivers are adjacent to heavy industrial use zones, presenting potential toxic exposures that we know also have an impact on health. And I'll show you some of those maps in a second. The two census tracts closest to these industrial zone areas have the highest cancer death rates in Wyandotte County. The irony, if we look at the irony and contradictions and racist logic of the phenomena of white flight that helped create these vast pockets of extreme poverty, right? That based on Hoke assessments, lenders found Blacks to be a profound threat to property values, and just having proximity to African Americans would have material consequences. Investors and real estate brokers use this fear to their advantage to swindle both fearful white families and hopeful Black ones. Fleeing whites sold their homes to blockbusting investors for less than market value. And lenders sold those same homes to Black families at above market prices on installment plans because banks would not issue FHA loans to them. And so what's the difference between buying a house with a mortgage versus an installment plan? Well, you buy on an installment plan, has no legal protection. You build no equity, and you can be evicted if you miss a payment and you don't get any of that equity, or you don't have a chance to recover any of that equity. So the fear of falling property values and high crime became a self-fulfilling prophecy as systemic divestment from red line neighborhoods, neglected school districts, and declining economic opportunities led to concentrated islands of desperation and despair. So now let's look more closely at some of the contemporary health impacts on health and structural violence that this legacy has created, right? For instance, those currently living in historically redlined neighborhoods are highly vulnerable to air, water, and noise pollutants. Historical redlining is linked to increased risk of diabetes, hypertension, and early mortality due to heart disease. Residents in previously degraded neighborhoods live in proximity to nearly twice the density of oil and gas wells as those in formerly A-graded areas. Living near oil and gas wells exposes residents to numerous pollutants that increase rates of cardiovascular disease, impaired lung function, anxiety, depression, as well as preterm birth. The systemic closure of hospitals across historically redlined communities has been a phenomena that we've seen, leading to less health access in these communities. And now Wyandotte County is considered a healthcare desert. Even with the presence of KU Medical Center, Wyandotte County is considered a healthcare desert. Historical redlining is also an enabling factor in the over-policing and hyper-incarceration of people of color, especially Black men, in the concentrated pockets of poverty that it produced. And this hyper-incarceration itself incarceration is a structural determinant of health in itself, not just for the person incarcerated, but for family members, spouses, and children as well. Being incarcerated decreases years of a person's life and increases all kinds of risks and health ailments. Historical redlining is also a major contributor to education inequities, which are upstream determinants of health. And we'll talk about that more in a second. So let's look at some contemporary maps, right? When we look at the percent of persons who are non-white in their distribution throughout Kansas City, and we overlay that with a historically redlined map, we can see just how much they overlap each other, right? If we look at household income at age 35, this is a contemporary map where we're looking at household income across the larger KC metro area, and we see how closely it also aligns with historically redlined maps. If we take a look at diabetes, right, Kansas City as a whole has a 14.8% rate of diabetes. And how does that compare? Well, for instance, if we look at Mission Hills, right, the rate of diabetes is only 8.2%, so it's nearly double. So those who live in historically redline areas in Wyandotte have nearly double the chance of developing diabetes as those in historically greenline neighborhoods such as Mission Hills. If we look at acute hospital admission rate, right, in Wyandotte County, it's 18.5 for every 10,000 people. We compare that to Johnson County, where it's only 10.6. Again, almost nearly double, right? Where we're looking at ways that your zip code determines your health destiny because of this legacy of racial discrimination. If we look at the prevalence of hypertension, in Johnson County, right, the prevalence is 27%. But if we look at Wyandotte County, the prevalence of hypertension, 38%. Look at the rate of folks who are uninsured, right? Again, this one over double the comparison between Wyandotte County, that was historically redlined at 24.8%, compared to Johnson County at only 10.8%. And I talked earlier about Wyandotte County being considered a healthcare desert. If we look at the number of medical providers for every 100,000 people, in Wyandotte County, we only have 46 compared to 124 in Johnson County. Again, direct evidence of how our zip codes as are determinants of health based on this legacy of redlining. We also know that historical redlining is associated with present day air pollution disparities in US cities across the nation. And this is a paper here that recently did this analysis for a number of major metropolitan areas. And what they found is that if you see in that little chart there in the middle of the page, right, that historically green line areas have the lowest amount of present day air pollution. Compare that to historically red line areas that have the highest amount of of air pollution. And they're looking here, measuring nitrogen dioxide, which is a pollutant emitted by traffic, industry, power generation, and other combustion processes. And urban areas tend to exhibit like spatially sharp nitrogen dioxide gradients because primary traffic emissions are a major source of NO2. And city planners often put major highways directly through historically red line areas and avoided historically green line areas. If we look at redlining and climate change impact, again, here's our original red line map of Kansas City. And here we got a digital outline of the red line areas and those boundaries. But then look at how it translates into tree canopy cover versus impervious surfaces. So the black is mainly concrete and asphalt, and the green are your areas where it's very lush tree canopies and whatnot. And when we look at how that translates in the surface temperature, so when we have our days that hit in the high 90s and over 100 degrees, we see that the historically redline areas are experiencing those heat waves a lot worse than folks in our historically green line areas where we have that lush tree canopy, right? And this contributes to all kinds of heat-related ailments, to heat stroke, and is also related to indoor and outdoor air pollution and hospitalizations related to breathing difficulties. When we look at our sources of pollution in Kansas City, this here is also, we can see like different toxin releases from inventory sites, water pollution sources, legacy pollution sources, and all sorts of other pollution sources. And we can see how concentrated they are here in Wyandotte County, specifically next to and adjacent to the railroad lines that also highly crisscross many parts of the poorest areas and historically red line areas in our city. And those high pollution neighborhoods have a high cancer risk. Data released by the EPA's National Air Toxic Assessment in 2018 revealed that long-term exposure to ethylene oxide is significantly contributing to higher cancer rates in areas located close to facilities that emit the chemical. right? And despite these risks to human health, the EPA has largely failed to ensure that companies keep ethylene oxide emissions at a safe level. And this is just one chemical and a long list of dangerous chemical exposures plaguing the Kansas City area, and they largely coincide with historically redlined areas. So now I want to do a deeper focus on how the history of redlining has contributed to educational inequity and how educational inequity continues to be a major driver and structural determinant of health. So let's look at how has redlining led to massive educational inequities? Well, redlining led to concentrated pockets of poverty and depressed housing across the United States. And consequently, historically redlined neighborhoods have some of the lowest property values. Because school funding is based largely on residential property taxes, schools in historically redlined neighborhoods have the least amount of funding per pupil. School districts in neighborhoods that were given Hoch's lowest ratings today have, or they funnel more students into the criminal legal system than college. They also have a lower per pupil spending, they have bigger class sizes, and they have a lower average test scores and higher teacher turnover. And this is directly related to a growing income and achievement gap that we are seeing as a result of our inequalities in education, right? As the income gap between high and low income families has widened, the achievement gap between children in high and low income families has also widened. And the achievement gap between children from high and low income families is roughly 40% larger than among children born in 2001 than among those born 25 years earlier. So these disparities in achievement gaps are continuing to widen. And this is a legacy where the harm did not stop with the passage of the Fair Housing Act in 1968. The harm has not only continued, but it is expanded. And when we think about reparations, we need to be first thinking about how do we actually stop, right, these systems of discrimination that are continuing to produce harm. Was these disparities in school funding taken up by the courts? Yes, it was, but the courts largely threw up their hands. The Rehnquist court had actually decided that the Constitution does not guarantee equality of education. And they said that it was therefore inequality in education funding is not a violation of the 14th Amendment. And so they largely left it to the states and threw up their hands to ignore the problem. The federal government has done a little bit to offset this, but not a lot. And it's because Americans don't largely vote for policies and for policymakers that are willing to make major change when it comes to this, right? And it's because of our legacy of racism, right? It's the same reason why we don't have universal health care, because in Americans' minds, they feel that increasing funding for education benefits poor, lazy families of color, right? And that is the American way, right? To forego funding in any public endeavors, to forego social solidarity because of our perceptions that doing so helps and benefits those who are undeserving in their poverty because they are lazy, because they are Black, because they are Latino, because they are Native American, etc. And this social solidarity problem is at the heart of why our educational inequities continue to exist. So further looking at the health impacts of educational inequity, there are at least 5 interrelated pathways through which inequities in education are linked to health equity. So for instance, higher quality education affords higher wage employment opportunities. It increases health literacy and health behaviors. It enhances social standing, which affords greater autonomy in the labor market. And persons with higher education are unemployed less frequently, which impacts levels of stress and is strongly associated with worse health and excess mortality. So the more stress you have from going through stretches of unemployment, the shorter your life is going to be. Persons with higher education are also more likely to work in safer environments with better health benefits. We often idolize what we call an honest day's work that has some real physical manual labor to it. But what we don't think about is all the labor-related injuries and chronic pain that those jobs come with, right? And so working in the blue-collar sector, you're much more likely to be working in a job that is going to have long-term detrimental impacts on your health. So, in contemplating repair, where do we go with this information, right? First and foremost, we have to understand that the health of Kansas City residents can only be fully understood in the context of this history. We are currently living embodiments of this history. Our past discriminatory practices remain structural determinants of contemporary health today. The highest rates of poverty, of unemployment, of persons uninsured, of cancer mortality, of cardiovascular disease, of diabetes, of infant mortality, and maternal mortality all remain concentrated in historically red line neighborhoods. And so reparations should really begin by putting an end to the policies that continue to drive our inequality. So I thank you so much. Happy to entertain some questions and just be in a discussion with you all. And I thank you so much for having me. It's been my pleasure to share with you this afternoon, and I look forward to further discussion. I'm going to stop sharing my screen so we can all see and talk to each other here.
Thank you so much, Dr. Glenn. This has been an amazing presentation. It has been very obviously very well researched, and I'm going to say right up front, I think this is definitely a presentation that should go to our full group, and probably even part of maybe a special presentation that we should organize to present to the community at large. Definitely.
I'd be happy.
Go ahead.
I said I'd be happy
to. Thank you. Dr. Jones, are you in place anywhere? No?
Yes. Hello.
Hello. How are you?
Hi. Yes. Thank you, Dr. Glenn. That was wonderful. That was wonderful. Thank you so much. I don't know if we have any questions from the public, but I do have a question. So, as you know, as a commission, we've been tasked with identifying practices and policies within the city that have contributed to inequities where there's need for repair of those harms. So you talked a lot about J.C. Nichols. Are you aware of how the practices he put in place, how were they intertwined with city policy at all, or what was the city's role in any of that?
Well, they were certainly enforced, right? And the city played a role in their enforcement. Those racial restrictive covenants, they couldn't have taken place without the full cooperation of entire communities, right? That you have to have not only realtors that agree not to sell, you have to have local courts that uphold those agreements. You have to have police that also enforce those court decisions. And so this legacy, it is a legacy that couldn't have taken place without full community involvement and cooperation.
Yes, thank you. Um, uh, Commissioner Hartsfield, do you have any questions here? I want to ask our commissioners before we open it up to the public. We are what just about 5 minutes, so I'm going to move to the public. If Commissioner Hartsfield, if you didn't have a question.
No, I don't have a question
Okay.
at this time, but certainly enjoyed this presentation.
Okay, thank you. Eric, would you open this up? I don't know how you do that to the public for any questions that they may have.
Okay. Floor is open to the public. If you have a question or a comment, please raise your hand and I will allow you to speak. And Bob, you are our first person. You're go ahead and unmute yourself.
Okay, I agree with Linwood that this presentation should be made to the general public somehow. It's excellent and so well researched that it's indisputable and should be made not just available but presented to us folks. And I thank you, Dr. Glenn, for your presentation.
Thank you. My pleasure.
Okay, is there anyone else out in the public that'd like to make a comment or have any questions? Okay, no one's raising their hand.
Okay. Well, one of the things that we certainly will do. We have a retreat coming up.
Okay,
This is something that we certainly will raise. I'll raise it if Commissioner Jones doesn't.
okay.
At the retreat for how we do this as a general information session for the public, not just health, because it obviously connects not only health but also to housing, to education, and it certainly connects those three and to criminal justice. So Dr. Glenn has background in many of these areas that we are responsible for
Okay,
researching and presenting to the public. Yes.
we got one more we got one question out in the audience.
Okay, go ahead. Yes.
And let me do, hold on. And Shakidra, you can unmute yourself.
Hello. I don't have any questions. It was a very thorough presentation, but I definitely wanted to thank you for taking the time to share that information. I was born and raised in Wyandotte County, so that really hit close to home, and witnessing the changes. It just very thankful to have you present that information, and wanted to thank you.
Thank you so much, Shakidra. Did I pronounce that right?
That's correct, Shakidra.
Right. Thank you so much.
Great.
Okay.
Well, we are right at the end here of an hour, and your presentation was also very well timed there as well. So I'm going to, unless Dr. Jones, if you had something you wanted to conclude us with, I am going to call this meeting to adjournment. I guess there were some other things on the on the. Let me look at the agenda. There were some other things on the agenda. We don't really have, I guess, time to do anything else, and probably don't need to do anything else at this point. Let me look at the agenda on my phone here. Speaker, old business. Did we have any old business that you wanted to bring up in a minute here to think about for our next meeting?
No, I don't have anything else. The only thing I was going to mention to Dr. Glenn that we do have an RFP, a request for proposals, out for an investigator or investigators to help us with doing the research to put together our report. So if Dr. Glenn knows of anyone who might be interested in helping with this work, we can certainly get him that RFP. And
Yes, please.
and
Please
again,
send
yes, we will definitely send that your way. And then we would love to just continue to engage with you with all of your deep knowledge in these areas. So we'll certainly be in touch, and really appreciate your time today.
Yes, and I think just to add on that, I think generally the same methodology that you've used to elucidate Wyandotte County's issues would be very applicable to Kansas City. The question that Dr. Jones raised about Kansas City culpability is very important in this, and it's not just what the city did to support realtors and others, but it's also what they did not do, particularly after laws were passed that should have made it unlawful to do some of these things. The city did not intervene, so that's also part of their culpability as well. But
Indeed.
okay, so we will definitely get that RFP out to you. I think you would be someone we would want to continue with. So if nothing else, I'm going to call this meeting adjourned. Thank you.
Have a great afternoon, everyone. Thanks
Thank
for
you,
having me.
everyone.
Thank
Have a great
you.
rest of your evening.
Bye-bye.